Thank you very much, Elisa, for the lengthy and beautiful introduction. A lot of you want to know, with all of that stuff that we know about ourselves as second generation and some of the effects that we talked about and some of the strengths and some of the liabilities, so what can we do now? As a patient of mine, a new patient asked me this week, okay, so what can we do now when she's 62? I thought that we would talk a little bit about something which is a way to think about deepening our connections and work on our relationships now, which is not specific to children of survivors, by the way. It's something that anybody can do. And in the next meeting, perhaps, after we talk about this, I will specifically tie it to some of our unique themes. But I think it's very useful as it is. So the goal, I'll talk with you about that. The goal of this way of looking at things is, like I said, to deepen and reconnect with our partners. And there is a particular format that I use, which is called the dialogue. It comes from certain ways of doing couple therapy. And I want to explain, I would like actually, if we get to it today, great. If not, then next time. I would actually like to show you exactly how to do that. It's a form, a very specific, very structured way of having a certain talk with your significant other. It can also be not just with your significant other, anybody that you have a really meaningful connection with and you need to discuss something with. And you have to think about it as a learning exercise. It's supposed to be done a certain way, a very structured way, in order to teach us very, very important elements of what we think is a much more constructive, active way of listening. Because really, that's the most important skill that we need to learn, is how to actually listen in a different way to the people that matter to us, with whom we have conflicts or differences or difficult issues to discuss. It's not so much, of course, we also have to learn how to talk to them. And that is also taught in this particular very structured format. Now, the goal is that we can afterwards use that format in a much more flexible way once we understood the concept. It's really like we learn everything else. When we go to school, right, we first learn how to write the letter Aleph in a very structured way between two lines in exactly that height, right, again and again and again, very structured. Afterwards, when we've learned it well, we can write Aleph a little bit more fluently and a little bit more the way we want it, right? So this is the same thing. It's how to learn certain principles and really make them our own, and afterwards you can use them no longer in the format of the dialogue because they have become something that you've internalized. So hopefully we will get to actually talk about the dialogue itself. And but first I want to speak a little bit about its background. So the purpose when we talk with our partner, I guess this is, I will mainly speak about how we talk to our partner, but it's really, like I said, about talking with anybody that we have a deep and meaningful relationship with and issues that we need to clarify. It can be a sister, it can be our child, it can be all kinds of things, but forgive me if I will just use partner as the generic here. The purpose in our speaking to the other person about a difficult topic is what? Often it looks like, honestly, like our purpose is just to vent, right? To vent our pain, vent our frustration, vent. But the real deep purpose of these conversations is not to vent. The real deep purpose is to explain what wounds us and to hear what wounds them. That's really what we would like that conversation to accomplish. However, often, in the way that we do it, we actually achieve the opposite, and we'll talk about that, right? Because by the time we come to have that conversation about a difficult topic, we sometimes have so much frustration, or we are so unsure of the possibility of being listened to and being understood that we say it in a defensive or in an aggressive way, in a way that, as you will hear me say later several times, because that's the way I always say it. I say, we have to say it in a way that goes nicely into the ear. It shouldn't go in a way that hurts the ear. If it hurts the ear, you lost the other person. It has to go nicely into the ear. That's our responsibility. So we talk about the skills of the talker, and we talk about the skills of the listener. The listener also has to develop specific skills. So the purpose of this type of communication it is not specific to the children of Holocaust survivors. There are things that are very specific. The nature of the wounds, as we see in studies, and as we talked about until now, I spoke about what studies and research shows us about the specific wounds of children of survivors, the specific injuries that they carry, the specific painful memories, painful relationships in the experiences in the relationship with the parents growing up. And I'm not talking about bad parents. I want to emphasize again. I am not talking about bad parents, although, as I said, there is a big group, too, of parents who were really very injured and unfortunately did function as bad parents in the sense that they were abusive. But the majority were not. The majority were good parents. However, what we talked about in the first 5 meetings is that good parents who were exposed to terribly traumatic events carried with them certain reactions, certain ways of experiencing the world around them, fears about the safety of their children in the world, an unavailability for the things that parents ought to be available to if their child is supposed to feel that their own unique, distinctive features are valued and all of that. That was difficult and is difficult for parents of all kinds of terribly traumatic experiences. People who've been through that have issues with these capacities that interfere with the quality of their parenting. We see it all over the globe in many, many different situations. However, we spoke about those unique things of the children of survivors until now, and what I got in your feedback was a request to talk a little bit more now about what can we do. Now, the what can we do, as I'm presenting it today, is not unique to children of survivors. I'm presenting right now the model of working with everybody's childhood wounds and how they interfere with anybody's ability to be their best self in a partnership or in a relationship. In the next meeting, I will go back and specify how this model translates more specifically to our unique wounds. But right now, just think about it. It applies to you as it applies to anybody else. Whichever issue there are issues that each of us brings from our different backgrounds to our relationships as adults. Somebody is the child of an alcoholic parent. Somebody is the child of a parent who was a very driven and successful and amazing professor at the university, but they were experienced by their child as a little bit more too demanding and unappreciative of the child's athletic abilities. And for the child, that was the most important thing, and that's their injury. Okay, whatever it is. Okay? All right. So our purpose in this way of talking, we want to learn a way of talking about something that, that is difficult for us, but nonetheless in a non-blaming, non-shaming way. We want to be able to understand ourselves in a non-blaming, non-shaming way, as well as our partner and our parents. And what we want to do is understand those needs that we had in childhood that were not fulfilled in a good enough way, that are still sort of with us as things that we bring to our relationship, and that there is sometimes a lot of shame, a lot of blame, a lot of even self-hatred that is associated with some of these aspects of ourselves. Okay, so there are a few very basic needs that we talk about in terms of childhood needs. What do children need? Attachment needs is one big category, right? We are mammals, and we grow through the attachment with somebody who takes care of us and provides us with safety and provides for very important needs, and that's a very, very important context for our psychological development. So the developmental impulse, the main thing that we need to bond, we are born, and it's amazing to see now that we have all of these technologies that allow us to check all kinds of things, it's amazing to see how early the impulse to bond operates in human infants. In fact, studies show that infants in the womb have an increased heartbeat rate when they hear their mother's voice, as opposed to singing, as opposed to when they hear another woman singing. So we are prepared to bond with the person that is with us all the time from before birth even. Well, I don't know about the fetus. This I really don't know. But we do know that trauma in the parents, and that's what we've been talking about for several weeks. We were talking about intergenerational transmission, which is all about the findings that we have, which are pretty robust and in many, many ways show the same thing, that mothers who have trauma in their prior history especially though, and that's a very important qualification here, especially mothers who did not have a chance to deal with their trauma, who did not have a chance to process it and to heal, transmit their wound to their infants and to their child. Absolutely. There are mothers with very traumatic histories who don't transmit it because they've done something else with it. So it's not like across the board. It's not about the trauma exposure so much as it is about the level of processing and what was the person able to do with that before she became a parent. Okay, so attachment needs, if all goes well, then the main message that the child takes from those relationships is it's okay to be, it's safe in the world is safe, and your needs will be met. There is somebody who takes care of you, and your needs will be met. And that becomes, it's a very basic message about those things that the child internalizes from that. The healthy outcome of it is that people who had their attachment needs met fairly well will be feeling that they'll be showing that they have a certain degree of emotional security and what we call emotional coherence, in the sense that everything kind of makes sense inside, as opposed to if I look at one of the strengths and the liabilities that I spoke about last week. For example, I said, a lot of children of survivors, and particularly women, very talented. It's a very talented group, all in all. Have this amazing recognition of their own talents and abilities. They know that they have it, and they know that they have it, but they have a very difficult time selecting their own direction, deciding about their own direction, following their own direction, and using their talents very well in the service of their own goals. The same women have no problem using their talents very effectively for somebody else's goals. That is an example of incoherence, if you like, or lacking coherence within the self, because what it means is that on one hand, you have this strength, you have this ambition, you have that competence, but on the other hand, there is something that allows you to use it only here, but not here. So what's getting in the way? Why is it not that you can use it anywhere that you would like, across the board, depending on your choice? Why only in the service of the boss, your parents, your husband, somebody else, just not me? Because, as we talked about in previous meetings, one of the overarching concerns that dominated in the childhood and adolescence of children of survivors was the very, very profound awareness to the parents' pain, to the parents' emotional needs, and that was a very, very that overrode one's own needs to do all kinds of things, especially since following my own direction, doing what I wanted to do, putting my all into it, often meant things that caused pain for the parents, because it took you out of the house. It took you out of the house until late. Your parents worried. Your parents didn't want you to go on that trip out of the out of town to this thing or that thing. So you learned that following your thing comes at the cost of your parents' pain, somebody else's pain. And you learn that that's not okay. However, it is okay to use your talents and use your competencies and all of that if it's in the service of somebody else's needs. Then it's okay. That is an example of incoherence in the development of one's sense of self. So the healthy outcome would be, as I said, if attachment needs were met well, there will be emotional security and coherence and a capacity to adapt flexibly to many, many different demands in the environment. Another group of needs that children have, which are very, very important, are the needs to explore the world and needs for mastery. We need to learn how we do things and feel that we can do it. And the developmental sort of impulse or impetus is to separate from our mom and reconnect. And you see it very, very clearly with little kids around the age of 2, when they begin to be mobile by themselves. When they can walk, they start being able to walk by themselves, and they will walk away, and then they have to come back, and they just touch you, and you think, oh, they want to be with me now. You want to pick them up. As soon as you pick them up, they're like, they're wiggling away. They want to go away. Now, it's not that they don't know what they want, and they're confused. They know exactly what they want. They want to explore the world, and it's a little bit scary, and it's a little bit new, so they need to know that they can explore the world, come back, touch you, Make sure that you're still there and you're okay and you're not going away, you're not angry with them. They touch you, they see you're there, everything is good, you're their safe base, and now they want to go back again and explore. Now, parents who are depressed, parents who are anxious, parents who suffer terrible losses and are very sensitive to the whole concept of separation may have a problem with that. They may want the child to be more with them. They may have a difficult time when the child leaves them every time to go exploring. They may communicate to the child, oh, come on, oh, you're leaving mommy again? Come on here, mommy is sad. Now, sometimes people do it actually verbally, who don't really understand what they're communicating. And sometimes it's not verbally, it's just by the way that they act in their body language and so forth. If it's okay, if the parent supports the child, in venturing out and goes like, oh, wow, you went all the way there, and what did you bring me? Wow, that's amazing. If we support the exploration, if we communicate that that's healthy, that that's okay, that we're not offended by the fact that they left, we nurture these exploration needs, and we also need to set reasonable limits, of course. So the child needs to feel that we are creating a safe sort of structure around them, that, if they're going to stick a fork into the outlet of the, or if they're going to, we're going to say no in a very limit-setting way, not hysterical, not whatever, but, there are boundaries, there are reasonable limits set, and so forth. The healthy outcome would be, the message of that whole type of interaction between children and parents around exploration needs, the message is that it's okay to explore, and even more, that it's okay to explore the world, that it's okay to be interested and curious and go out there and explore what's out there. You don't have to just stay in the relationship here with me. It's okay for you to be interested in the outside world and turn away from me. It's okay to separate, and it's okay to return. There's no retaliation for going away from me, and there's no cost to me. I'm not sitting here biting my nails and crying or agitated and anxious until you come back. Yes? Now, as you see by the language that I'm using, some of that, not so much with infants, but definitely with adolescents, actually touches upon some of the issues that were difficult for survivors. The reason I'm talking about it is because all of these things are sunk into our fibers, and all of these things are acting out guaranteed. I can guarantee you that if I asked you about the events of the last week in your life, I would be able to show you right away how exactly the way that you resolved things or did not resolve things is reflected in the way that you responded to things this week. So that's why we're talking about it. So, and I'll try to talk as fast as I can, and studies do show that we transmit a lot of it to our children. Now, I don't know about your wife. That's your wife, right? No, not your wife? I don't know. So sorry. I don't know about your wife, if she's a child of survivors or not. Oh, she is. Okay, well, some of us who married not children of survivors, then there is again this diluting effect often. Some of us married children of survivors, and we have to be aware of these things. That's all. Okay, so the healthy outcome, if exploration needs were supported well enough, will be that the healthy child will begin to have a sense of separateness and safety in exploring. It's okay to go, it's okay to do. I'm not losing anybody behind, and I'm not hurting anybody behind when I'm expanding into the world. Another group, let me see, I'm going to try and speak as fast as I can, but we'll see. We'll get to wherever we get to. Okay? So, another group of needs that children have to do with the development of their sense of identity. So the developmental impetus, the impulse behind it, is we want to express as many facets of our evolving self as possible. Yeah? Through these, if you think about children, what they want is they want to express how they dance and how they do this and how they do that, and the different aspects of their self evolve through relationship with other people, what they learn. Now they imitate mom, and now they imitate this person, and they learn all kinds of new things through what they internalize in these very important relationships with different people. With the grandma, with the kindergarten teacher, with people now on TV, with all kinds of identifications, and they want to express as many of them as possible and try them on, just like they like to play dress up. They like to try on these identifications and play with them and see how does it feel to do this, to be bad, to be good, to be like this, to be like that, all kinds of things. That's a need that children have to explore all of these facets. Nurtured when the parents mirror these things in a positive way and sort of accept it and in a positive way and say, how nice that you're like this or like that, and it's just not shaming, not sort of narrowing the expression of these facets, but allowing the child and not saying, oh, well, yesterday you were so fond of such and such, today already that's it, today. All kinds of ways of shaming the child for trying these different identifications, and therefore communicating to them, you need to be very narrow, you need to only be this and that, don't expand too much, don't play too much with these different facets, because some of them are not so okay with us. If it all goes well, the main message is it's okay to be you, and it's okay for what is you to sort of have some flexibility to change, to try on things. It's not just like, this is okay to be you like that, and that's the way you have to stay for me because that's the way I like you. But it's okay to be you, and it can flow and change a little bit. And the healthy outcome is what we call a secure and a well-integrated sense of self, because I had a chance to try this on and try that on, and I have a feeling that, I got my chance to try all of these things and figure out what of it is me and what of it is not so me, and here is what I've come up with at the end of my adolescence or young adulthood. Another group of important needs are needs for competence. We need to feel that we are competent and powerful and effective, and that we can do a lot of things in a masterful way. It's a very, very important need that we have. And it's nurtured when we set appropriate tasks and we give appropriate instruction and directions to children. This is a whole big lecture in itself, which I'm considering maybe to actually include in our series at one point, because I think it's important to us as grandparents and even as parents to our adult children, because I think I will just say that in Ma'amar Musgar, in brackets, I will just say that our culture is going through an enormous transformation in that way, where the relationship between parents and children are really transforming from a much more hierarchical relationship where it was clear that the parents were parents and the children were children and the children were supposed to act a certain way towards parents and this and that. And it's transforming to something very different where, depending, of course, on which culture we live in, and you here are still living in a certain subculture, there are other subcultures, but essentially children are becoming, by many, many studies that we look at, much more entitled, much less feeling much less obliged by what I would say, filial obligations, the need to behave a certain way toward your parents, whether you like them or not, whether a lot of things are changing. And there is a claim that we are seeing an increase in what we call narcissistic personality disorders. So that's a whole other lecture. But let's get back to this one. It has to do with this one little innocent sounding sentence that I had here in the second point. It has to do with our own confusion. We are transforming, as I said, from notions of parenting that were very authoritative, right, and limiting, and had their own problems. 19th century child rearing concepts with the parent. Mary Poppins, who remembers did you watch Mary Poppins? That father who's very, Yeah, so those are 19th century relationships between parents and children, is like between that father and his children. And we're changing to something that, and that had its own problems, repression, suppression, all kinds of things. Children had neurotic, fears. They weren't allowed to be themselves and to express themselves as freely as I just said is so important and necessary. So it had its own set of problems. But the new set of problems has to do with parents trying to be so liberal and so affirming of their child's whatever, and so nurturing that there's too little boundaries and limit setting set on children, so that they think that they are, that they're entitled to all kinds of things, and that they have too little understanding of what is also expected in order to make the other person feel okay, not just you, but the other person. And also, if we don't nurture, if we don't give children appropriate challenges And if we don't provide alongside with those appropriate challenges from the time that they're little, tasks, things they need to do, if we don't provide also appropriate instructions how to do it, then we don't do something very, very important in the sense of activating needs. There are nurturing needs, which are the things that we need to give a child to make them feel good. But there are also activating needs in children. We need to do something with them that activates their own potentials, their own abilities. They need, if we don't give them an appropriate opportunity to see what they can do, because we do, and we make it so easy, and any effort is good enough, then we never get them to actually flex their psychological muscles and flex their potential. And with that comes a sense of mastery and a sense of self-esteem. So paradoxically, if we nurture children too much and we don't give them enough activating opportunities, because we want them to feel so free to be themselves and so good about themselves, paradoxically, we are creating a situation in which they don't have a chance to develop healthy self-esteem because they never got to feel their own strength. It was too easy. So if we nurture competence needs well, then the message to the child is, go for it, you can do it, and I'm here if needed. You have me at your back. If you don't know exactly, but go ahead, I trust you, I think you can do it, and I'm right here behind you if it's necessary. And the healthy outcome would be a sense of personal effectiveness, power, and competence. So these are the very important groups of needs, and that's what we get out of it if it's okay. So these are the things that we all have to ask ourselves. It's like pointers for each of us to think, okay, let me see about this and about this and about that group. How does it apply to me? What was it like for me? It's just some stuff for us to think about. And when I want to talk to you about this particular way that I mentioned of working with couples, it's really best to apply for couples who are in a committed relationship, but not only, as I mentioned. It's encounter-centered couple therapy, which is what I'm going to present to you later with this particular way of working in the dialogue. And I have I have a feeling that we will not get actually to describe the dialogue today. I will absolutely describe it to you the next time because I think it's very, very important. But we'll get as far as we can. So what we think is the following, and that's why I'm talking about these things from 60 years ago. What we think is that in principle, that's the psychology that I operate from, and I'm not alone in it. It's very similar to Imago. There are a whole host of what we call experiential couple therapies. And that's one of them, and they all share a lot in common. That's, in fact, one of my beefs with my colleagues in the field, is that everybody has to take the same thing, tweak it just a little bit, and give it another name. So we have Imago, and encounter-centered, and Sue Johnson's emotional focused, and a whole lot of other ones with different names that are essentially about the same. So I'm not calling it a particular name right now. I'm giving you the principles. Okay? So the principle is that if something did not get completed well enough in our childhood that pertains to one of these very important needs in childhood, needs in the evolution of our sense of self, we want to complete that. And we do a lot of things, some of them good and some of them crazy, in an attempt, guided or misguided, to complete that task of childhood that was not completed well enough. And the purpose of our unconscious, if you like, yes, is to get to a better resolution, of that area or aspect of ourselves that didn't get what it needed and didn't get to be where it needed to get to. So those gaps, if you like, we are driven to try and get them resolved better. We're driven to try and get to a better place. And in choosing our romantic partners in particular, the assumption is that we actually choose mostly unconsciously, especially, of course, let me make sure, it really only applies to those partnerships that were created by our choice. If our parents chose and it's a match made by parents or what, then it doesn't apply. These rules don't apply. Some of it does afterwards. I studied for my PhD in Hamburg. And I had a very good friend who was a physicist, a PhD in physics from India, who lived in Hamburg for 15 years. No, first in Texas and then in Hamburg. Very modernized and everything. And one day he said, I'm going to India. My parents prepared 4 brides. I have to go and choose one. And 10 days later, he came back with Mira. Lovely woman. He saw her 2 times, and now she was his wife. I was a young psychologist in a hospital, and I had a very good relationship with one of the physicians who also came from a different culture, where the same thing. He was in love with an American girl when he was in college here, and his parents said, you come and you marry this woman. And it was a very, very heartbreaking experience, everything. But even he stayed married, and it actually became a good marriage. So, but nonetheless, and it doesn't really contradict what I'm saying, because a lot of it still actually applies very, very much. And in fact, the profound wisdom of it is that it doesn't only apply to marriages that start with a whoosh of romantic attraction and whatnot. It actually is most important to use these principles when the marriage that did start in a great infatuation is in trouble, or if we want to prevent ourselves from getting into trouble and we're wise enough to know it, or when we need to actually work, when the infatuation doesn't do the work for us anymore, and now the real issues come to be, and we want to make the maximum out of this marriage. That's the real value of these processes that we're talking about. So again, but still, I'll just mention it, that in those cases where we choose our partner out of infatuation and romantic enthrallment, the understanding of it is that our unconscious actually does it from, we create in our relationship throughout childhood with the people that are most important to us, our parents, our very first and most important love objects, our parents. We create a certain psychological mental image, hence the imago. We create the imago of this love object, what they were like and how it felt for us to be with them. It is not necessarily an all-positive thing, our love imago, because, we could have loved a mother who gives and takes away. That could have been a part of our experience. We could have had a mother who is sometimes incredibly nice and warm and beautiful and sometimes depressed.
Question: do we choose a spouse based on who our mother was?
Our mother and our father all meshed together, and the ways in which we experience them, and their negative and their positive, and also what we liked about them and want to find, and what we think we want to find the opposite of. And the opposite, unfortunately, often turns out to be the same, because the opposite of the same of one thing is not a free choice. It's the other side of the same coin often. So you think you're choosing the opposite, and actually you find out, oops, right. So the view of the couple, we're looking at these principles now as ways of working on ourselves and on our spouse, the way they are, to make the relationship deeper, more connected, because really I think the thing that I think is very true, at least from my perspective, and not everybody has the same perspective on it, but my perspective is that happiness and closeness in the relationship, satisfaction in the relationship, I think is very much related to a very profound need that we all have to be very, very well known for who we really are, to feel that we are really seen by the other person, that our essence is seen and liked and valued, appreciated. And that is really what we seek and what is sustainable in a relationship. It's not the infatuation of the first, 18 months when the dopamines are rising and all of that is happening, if we had the good luck to have that, yes? But this way or that way, that period goes away, and you're left with the question, what is our closeness going to be like? Am I going to feel that my essence is seen, that I see your essence, and that we can really work with each other in such a way that those needs that are very, very important to me, which maybe got met and maybe didn't get met quite optimally, but I see what yours are, I understand them, you see what mine are, you understand them, and we work to maximize the meeting of those needs between the two of us for both of us.
Question: can two people, one the child of survivors and one who isn't, understand each other?
There are no generalities here, because, we're not talking here just about the fact that, of course, two children of survivors, why do you understand me so well and I understand you so well? Because it really goes beyond the words. It's stuff that we know implicitly. We understand it and other people don't. And in that way, it's helpful. However, do you remember what I talked, oh, you weren't here maybe, in previous meetings when we talked about what are some of our characteristics as a result of certain injuries, wounds, things that didn't get met so well because of the parents being trauma survivors. We have hyper sensitivities to perceived injuries. We have tendencies for depressive experiences. So if something goes wrong, and now we think that our spouse offended us, and now we're hypersensitive, so we got offended. Now, not only did we get offended because we're hypersensitive, we also have a tendency to get depressed. So we get depressed about it. Now it takes us 3 days to get out of our black hole, and there's nothing that's going to convince us out of our black hole. And we have all kinds of things that are related, that are features that have been shown in multiple samples to be higher. We are not more disturbed, as I said many times. As a population, there is no gross psychopathology in the children of survivors more than in others, but we have these elevated scores in all of these somewhat problematic things, anxiety, depressive, this, and that, yes? So you take now two people who have it. So, yes, I understand that your mother was a survivor and so was mine, but you know what? When you say this to me, I get so upset. And I'm so sensitive to it, and I take it so deeply, and now I get depressed for 3 days, and now you get upset because I said whatnot, and I said that you meant to say this to me. Now you're upset, now you're in the hole for 3 days. Okay, so what I'm saying is, though, is the premise is, I believe, okay, I'm not alone in it, but it's not the only way of looking at it, that happiness in a couple depends greatly on their capacity to get to know each other like that, to establish that kind of emotional intimacy, and to be able to fulfill each other's needs as best as possible. Now, that is not to say, by the way, that we can fix our childhood wounds. We cannot fix each other's childhood wounds. That is not the job we need to do as spouses. We can't, and we should not be expected to fix that childhood wound that was created. We can be expected to be the best partner that we can be as a mature, conscious, intentional person in the relationship. And when I say conscious and intentional, what do I mean? I mean conscious of these things and these issues and how they apply to me, these topics that I'm trying to, expose and talk. How does it apply to me? The fact that it applies to me, the fact that it's relevant, and I need to examine my behavior in the here and now, every day. And when I get upset at you now, I need to try to hang on to my understanding of this. And intentional, in that I mean that my intention has to be in front of my eyes all the time in a mature relationship. And by the way, mature is not the same as old. A lot of us are getting older or even old. Doesn't mean that we have reached psychological and relational maturity. A lot of us don't. So when I say, when I say mature relationship and intentional relationship, I mean a relationship in which two people have really come to a point where they put in front of their eyes all the time the question, is what I'm doing right now good for the relationship or not?
Question: what does it mean if the marriage is better now after 25 years?
If it's better now, you must be doing something better, absolutely. But it's also true that we can also make it better, always. We can always continue to make it better. And I think that one way, that's what I mean by putting it sort of in front of your eyes all the time, that one way to help ourselves continuously strive towards the right direction is to say, okay, I have an argument with you now. I'm really upset. Something really upset me. I can yell at you. I can tell you that I'm upset in a way that will be very offensive, and maybe it will help me get rid of some of my bad feeling, but is it going to do something good for the relationship? Is it going to improve our relationship, or is it going to detract from it? And if it's not going to do good, then I need to find a different way, which will still address the problem, but in a way that will actually allow us to improve the relationship and to resolve the problem and improve and get past it.
Question: can you give an example of when you think something is just the opposite, but really it's just the same?
That's an excellent example, and it goes in there's many manifestations of it, because actually what we see is that, concepts such as enmeshment and things like that, right? So there are families that are more enmeshed and families that are less enmeshed, right? Enmeshed meaning everybody's in everybody's kishkis, right? It's a clinical term, being inside, yes. So families of Holocaust survivors tended to be more enmeshed than Goyish families of certain kinds. Not all, but yes. For example, so often what happens for a child from an enmeshed family, there is a need to get away at some point, right? So they think they find somebody, and that person is very different from their family, and they feel that person will really take them away from there because they're very different. And they usually choose someone who at face value or at the, at the surface is very different in many ways. However, lo and behold, what happens then? What happens then is they discover that they get very enmeshed with that spouse. He or she are very different from the parents in many ways. The parents were Holocaust survivors and were this and were that. Let's say the spouse is not a child of survivors and is all about, these things about your parents and your family are, crazy. And they're very, very different, but they're very, very enmeshed, and they require great enmeshment, great loyalty, great adherence to their way of being in the same way that the parents required it. It's just we have in Hebrew the expression "Ota geveret b'shinui aderet." It's the same lady with a different coat. So the point is that the imago that we create in our childhood of the parents that we had, the way they were, their positive aspects, their negative aspects, and especially the way we felt, the way it felt to be in a relationship with them, the good and the bad, but how it felt for us, that's the imago. And with that we walk in the world. And with that, we sort of, if we're talking now about relatively free choice of spouses, we go, not you, 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 what? You! Because you somehow remind me of my imago. And the hope there is that because you remind me of my imago, I have a second chance here with you. I can have the same experience with a different outcome. Now, Einstein said that that's the definition of craziness, right? To think that you'll do the same thing. However, that's what drives it. Yes, okay? Insanity, exactly. But that's the point. And the good thing about it is that it's a very optimistic view, but I think a very, very true view. This I say now as a couple therapist with, over 25 years of therapy with couples, and I'm not just a couple therapist, but I do a lot of couple work, and as a woman who's been married for over, 25 years now, I think there is a true and optimistic view here of what we serve for each other in terms of that second chance, because it's not only that we are like, oh, I'll get from you all the good things that I didn't get from my parents. That is a mistaken expectation, and that would be the expectation of someone who thinks that this person who reminds me of my imago will fix all the things that didn't go right the first time. And that doesn't work. What does work is you are exactly similar enough in ways that will frustrate me in the same way. Yes? And that now, because I am an adult and I am conscious and I want to use it for my growth, I can feel the frustration. I use it as a pointer to an aspect of myself that is underdeveloped, and I'm now going to develop that aspect better. I'm now going to use that as an opportunity for growth. Not because you're going to give me what my mom didn't give me, but because you're going to frustrate me in the same way that my mother frustrated me, and now I will look at myself and say, so what can I do about it in a different way, right? So essentially, it's a very nice way of looking at it. So next time when your spouse frustrates you and you're about to get very angry with them, I recommend that you say, thank you, sweetheart, for giving me the opportunity to look at an underdeveloped aspect. Just kidding, just kidding. Just bite your tongue and just think for a minute about the fact that this is a moment in which you do get an opportunity to think about yourself, what's happening here, what is happening to me, because each one of us will be hurt and will hurt the other person in a way that activates your adaptation in your childhood, the way that you adapted to that frustration will be activated. Yes? And that is where we have a chance to change a lot of things. Yes? So you frustrate me in the same way that my mother frustrates me. Now my adaptation to it gets kicked up and is activated. That gives me a chance to see what I did, which might have been the best thing to do and the only thing to do then, but may no longer be the best thing to do now. Because in the end, I am not married to my parents now. I'm married to somebody else. This person may have a different potential to deal with me differently if we both rise out of our childhood adaptations, which become so automatic that we don't even notice them. They're so part of who we are that we don't notice that that's the way we respond. We just think that's the way it is. That's the way to respond. We are unaware anymore of other options unless something highlights it for us. The purpose of this talk and the one that will follow is to highlight to each of us that we have a whole lot of other ways to respond which we neglected throughout our development because they weren't useful in our childhood home. It was not possible to say to my mother, let's say, Mom, I understand that this was that you don't really want me to do this, but I'd like to explain to you why it's very important to me, and to have that kind of a conversation and this and that. Maybe it wasn't possible, so it got neglected because something that doesn't work for us in that context repeatedly doesn't work, gets neglected, and what works becomes the way that we respond. Now, that's why when our partner does something that creates the same feeling in us, it is actually an opportunity to highlight what are you doing in this minute? How are you responding? It highlights to you what you're doing, and then you can actually reflect upon it, think about it, and see that there might be other alternatives that now are possible with this spouse that were not possible before. Listening empathically, which is what I'm going to talk about, what does it mean to listen empathically? Often we don't listen empathically, really. I mean, it's unbelievable how hard it is for intelligent, sophisticated people to sometimes get it. What does it mean to listen empathically? I have people come and they talk, and the other, you will see that the format of the dialogue and the reason that it's so structured is so important because you have to actually really listen to what the other person says and reflect it back in the same words as much as possible. So if I said right now what I said, and if I were in a dialogue, my counter person would have to say, so I hear you say that in this format of a dialogue, you have to repeat what the other person said in exactly the same way. Did I get you? The same words. Because it's just a way to write Aleph, like I said in the beginning, in a very, very clear way until we understand it. It's a way to understand that we really have to listen to the other person in their words. We all the time interpret, summarize, paraphrase what other people are saying to us. We are busy thinking about our answer to it, our view of it. We are busy with a whole lot of stuff. What we're not doing is simply emptying ourselves from our own stuff and listening to the other person from their perspective in their words. And let me tell you something. Once you begin to be very aware of that skill of listening, that capacity to listen empathically, you see how quickly, if somebody tells you, I feel blah, 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 and you change only one word in what they say, it's already not the same thing. And they say, no, not exactly. I didn't mean that. Now you're already on a tangent. They're already having to answer you about what you didn't understand. You're already not there fully present to hear them about what they wanted to say in their words and in their way. Yes? So that's about listening empathically. Now, if we don't listen empathically, we trigger a lot of stuff in the other person. And I have this beautiful picture that I wanted to show you, which captures a lot of what we're talking about. It's a piece of art from a place called Burning Man. I don't know if you ever heard about it. Yeah, in Nevada. It's a beautiful piece of art, in my opinion. To me, it was like unbelievable, because what you see here, in a sense, is a very beautiful visual metaphor of everything that I'm talking to you about, in the sense that you have the two adults that are this rigid metal adaptation. These are the adaptations that we bring to our relationships from our childhood experiences. They became very rigid. They are the one adaptation that we bring to every conflict or to every frustration. That's the way we respond. It's a rigid, automatic thing that's like that. And its purpose, if you notice, the two adults are turned away from each other in a very defensive, self-protective position. That's the job of our adaptations, and that's what they do. They were created to protect us from hurt and from feeling pain. So if we had parents who were, let's say, if we talked about, the previous conversations that we had, if we had parents who, because of their own pain, were not able to be available there for us when we needed some, let's say, the empathy issue, right? We said parents who are very resilient were hardened a little bit. They had to not be very empathic to their own pain, to their own lack of sleep, to their own all kinds of bad things that they had to push aside in their minds. They sometimes weren't so empathic to the pain of children. We're like, come on, what is this? It's not so bad, like when I told you the example with Art from Mouse, right? Like, come on, it's not a big deal. Friends, you call this friends? Not a big deal. We learn to then, protect ourselves from the pain and from this. We have, and that's when we bring it to our later relationship, that adaptation, which was meant to protect us from pain and from hurt, becomes something that turns us away from each other, does not allow good connection. Each of us is protecting their own pain, their own vulnerability, their own soft belly, and it makes actually for a lack of connection. But the idea is that inside that rigid, fossilized adaptation, there is still the genuine, person that we were as children, who had a much wider potential repertoire of responses and is actually longing for connection and longing to encounter the other person and to reach the other person and to be reached and to be understood and to play together and to be together. What I said before is that these adaptations it's like pruning a tree, right? It's like a lot of other possible ways to respond were pruned away because they didn't work well in our family or were not exactly well accepted. If it wasn't modeled and it wasn't part of the emotional communication in the family, how would we know that, right? My husband comes from an English family. Yeah. So, I come from a loud Polish family, Israeli. I'm the youngest in my family, so I had a lot of Israeli culture being introduced to the family by the time I came around. There were a lot of new emotional styles that he was used to like 2 words, and that's a lot. That's a long sentence. Yeah. So, okay. So when we see, that's another very, very important point that we have to, I think, stop on for a moment, which is that, first of all, when the survival adaptation of one spouse hits the other person in a way that's not good, which will often be the case, it will create a defensive response in the other one, and then you get, if you like, these two people turning away from each other, each in their defensive posture. And also, another thing that's very, very important is that we often choose somebody as part of the choice and even if we don't choose somebody, but even if we choose somebody, we often will choose them actually because they have capacities that we don't have, and that we have, that we admire in them in many ways, just because we don't have them. For example, I had a patient who came to me in the midst of a very, very hostile, difficult divorce with her husband. He was this big bully who was really treating her like a big bully, and she was this very gentle, sweet girl, very, very sweet soul. And it turns out that the very first time they met, it was like that. She was a young student. He was a few years older. He was already working. They met, they both were in a bar with a lot of young people, and it was a very busy, popular bar. It was impossible for her. She was so gentle. There was no way she was getting to buy a drink because she was so gentle, and he saw her, and he just like, he was this big guy, and he was, he just like somehow parted the water and got to the bartender, got her the drink, and she was very impressed with just how powerful and whatnot he was. Well, afterwards, powerful became also powerful and bullying towards her. Right. So oftentimes we choose somebody for something that initially appears very appealing to us just because we don't have it. And then, once it's in a couple, that very same quality becomes something that we don't like and that upsets us. It is also true about qualities that are not necessarily bad in and of themselves. You know, he was a bully. You can say, okay, you know, she was attracted actually by his force, and it's not so surprising that it, yeah. But sometimes it's qualities that are not necessarily bad in and of themselves, but they are qualities that are underdeveloped in ourselves. In our way of growing up, it was not nice somehow in the eyes of our parents. And it can be something that is innocuous in and of itself, like punctuality. It can be something like emotionality. It can be something like sensuality. It can be something like voicing your opinion, being someone who's assertive and opinionated, the child who, ambitious. It can be things that are actually in and of themselves not at all bad, but in our family, it was not okay for let's say for the daughter to be opinionated, or it was not okay to be sensual. And so the little girl who, does something very innocent, but immediately is told, don't do that. That's not nice. Or it can be something, it can be really innocent things through which, though, the parent communicates, or let's say, you know how children have this, what we call childhood exhibitionism, which is very normal, right? It's like, look at me, and, they put the dress on, or they put something, and it's like, look at me, and they want to do. Now, in some families, it's unacceptable. It would get a very cutting response because, let's say, parents are very sensitive and to anything that appears like, we don't want our child to be too arrogant or too narcissistic or too whatever, and so it will be cut. And it can be cut so badly that it cuts into, the natural narcissism, which is actually a very necessary trait for assertiveness, for self-esteem, for good feelings about oneself, yes? And it can become the girl or the boy who have a problem speaking in front of a group, or doing anything that kind of appears like they're doing that little dance that they were told off not to do in front of their parents when they were 5. But it's not the one occurrence, right? We're talking about a repetitive pattern that has a consistency in it. What I want to say is that even when a certain trait that in and of itself is not a bad trait was beaten down or kind of repressed, underdeveloped because of those pressures in the family, we can marry someone who has that just because it's so appealing to us that they have it. And then, though, once they're married to us, once we're married to them, it actually becomes something that when it manifests itself, we resent them for it.
Question. Can you describe the opposite of that?
Yeah. You can be attracted in a healthy way to someone, partially because they have your underdeveloped traits, yes? But it's in a healthy way in the sense that a lot of the things that I will be telling you how to do when it doesn't work well, you've been doing naturally with them. You've been able to naturally think in such a way that you work as a team, which is what I'm going to try to teach when it doesn't work naturally. But there is such a thing as natural life therapy. Life does offer free therapy to many of us. You marry the right person. What I'm saying is there's no question about the fact that it happens to some people. Yes. And then great. Then they have those traits, you have those traits, you learn to work very well together. It doesn't upset you that they have that. You work with that, and you get them to help you and to do certain things in their area of strength. You do your area of strength, and you help each other to stretch. What I just wanted to say was that sometimes, though, when it doesn't work well, we actually hire the person because of those capacities, and then we resent them for the very same reason for which we hired them for the job, which is really not very fair, right? So we have to understand what it is there, and instead of that, to get to the point where we actually understand what we were doing in that choice, and how we each actually provide each other with two very important things: the complementing strengths. Even in the conflict and in the frustration, we actually have the nucleus there of seeing what are our different strengths. It's very upsetting in that moment when I'm fighting with you that you're not answering me exactly the way I would like you to answer to me. but there is also a nucleus there of how you think and what you're like and what your strengths are like, and we can see that too and work with it if we want to. And like I said, it's also a highlighting of what my needs are, what your needs are. Can we find a way for you not to become like me, and me not to become like you at all, but for us both to be much more aware of who each other is, not give up on the wish to change the other, but on the other hand, be much more willing to work together as a team and to work with the differences. Because the differences can be actually both complementary and enriching in that way, and also they can be invitation for us. When I see what you want from me that I'm somehow not managing to give you, I can also find in that an invitation for a stretching of an underdeveloped part of me, which is really what you're saying to me. When the prototypical wife, let's say, says to the husband, but you're not giving me enough emotional closeness, you're not talking to me enough, right? The prototypical thing, yes? There is, first of all, we will need to accept that that husband will never be speaking like her, talking like her, having the same interests exactly like her. But it is also an invitation for that husband to develop a little bit more of his emotional ability to relate to his own feelings, to his own inner world, and to her inner world. Not to become like her, but an invitation to stretch and expand an underdeveloped part. For the wife, on the other hand, that perennial wife, she needs to work with something else. She needs to work perhaps with she may have to work with a hole that she's been carrying, like a lot of children of survivors, if we go back to the specific wounds that I mentioned in our previous conversations, the sense that her, let's say, emotions did not have enough room in the relationship with the parents, that she always had to pay attention and, not demand and not express because it would have been too much for her mother or father. So she's used to that, and she's used to the frustration and to the feeling that there isn't enough emotionality there for her, and her emotionality is not given enough expression and not given enough resonance. And now she's carrying a very big hole inside, and she's bringing that hole to him, saying, fill my hole. Now, she needs to understand how to fill some of that hole herself, and what can she expect from her husband as a mature, conscious, good partner. What can be expected and what cannot be expected. For example, if we had a relationship with our parents where that neediness that we had was frustrated because we couldn't express it and mom did not have the capacity to resonate with this sufficiently enough and all of that, we might have developed, not always, I'm not saying always, I'm just using it as an illustration, as one possible thing. We might have developed a self-hate for that part in ourselves, because that part was associated with a lot of frustration, with a lot of pain, which we don't want to experience ourselves like that. We hate experiencing ourselves as hurt and wanting and longing for more and feeling like you don't give it to me and you don't give it to me. It's a very painful aspect of ourselves that we don't want to feel and that we hate. We hate the neediness. We hate the pain. We might have internalized some of our parents' attitude when it did come out, that this is whiny or this is weak or this is too demanding. I have a new word for the English language, which is specifically appropriate for many, many children of survivors, and that is the experience of the too muchness. That you are too much. Too much. You're too much. You want too much. You need too much. You are too much. You're too much. Yes, you're too much. In various colors and shades, you're too much. Because parents who are very preoccupied with a lot of stuff, with a lot of burdens, external and internal, experience the demands of a child as overburdening sometimes. And the result of it is that the child experiences themselves in the relationship with the parent as too much. Now, that is a part that a lot of children of survivors have a lot of self-hate for, which then, for example, you come to your husband and you say, I really need you to talk to me more. I really need you to whatnot more. If his defensive response is such that it evokes the too muchness, and you hate that piece in yourself, you hate feeling the too muchness, and you hate feeling all of that, now you got a nice survival dance there between their defensive adaptations that's not going to go well. So that's an example of when, also though, another possibility, and with that we'll stop for today, another possibility is, like I said, we can hate something in ourselves and therefore have a very nasty response to when the other person has it. So if we were the children of these stoic parents, and if we internalized it, let's say, and we became very stoic too, and we learned that we should not whine, and we should not talk about what's difficult for us, and we shouldn't whatever, and we hate the part that's whiny or complainy because we really, really rejected it and deleted it as best we could. Now our spouse comes to us with some complaint, or they need something is difficult for them or whatever, and we can't tolerate that. We hate that in ourselves. We can't tolerate it in them. That's an example. And then we'll have a very defensive reaction or a very aggressive reaction, and they will be very upset. But the reason that we had that reaction is because we can't tolerate this in ourselves. Yes? Okay, for today, this is it.